Hello, everyone. It's my great pleasure and honor to deliver the keynote address on the road to universal health coverage at the GapSummit 2020, at a time when the world is facing a global health crisis unlike anything we have seen in our lifetimes. A crisis that calls for collective action and catalyzing innovation. The novel coronavirus outbreak has demonstrated that what affects one person anywhere affects everyone everywhere. It has shown that if human beings are confronted with a health crisis like a pandemic, then universal access to quality healthcare for everyone across the globe has to become non-negotiable. What do we mean by universal health coverage? The WHO defines universal health coverage as all people and communities can use the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. Universal health coverage is based on the WHO Constitution of 1948, actually declaring that health is a fundamental human right. This is also stated on the Health for All agenda set by the Alma Ata Declaration in 1978. Universal health coverage cuts across all of the health-related sustainable development goals and brings hope of better health and protection for the world's poorest. The three key objectives of universal health coverage are: number one, equity in access to health services. Everyone who needs services should get them, not only those who can pay for them. Number two, quality of health services. It should be good enough to improve the health of those receiving services. Number three, protection against financial risk, meaning ensuring that the cost of using services does not put people at risk of financial harm. Let's talk about equity in access. Health equity means giving patients the care they need when they need it. Health systems are paying attention to disparities in the quality of their care and seeking remedies as healthcare costs rise and consumer demands action. They are doing so not just because it is the right thing to do, but because of the financial incentives, which are increasing, the legal requirements, and the bottom line benefits. Let's talk about quality of health services. As nations commit to achieving universal health coverage by 2030, there's a growing acknowledgement that access to services is not enough. Improvement in healthcare delivery requires a deliberate focus on the quality of health services, which involves providing effective, safe, patient-centric care that is timely, equitable, integrated, and efficient. Protection against financial risk is a key component of universal health coverage. Households can be impoverished or be faced with catastrophic health expenditure from accessing needed health services. Fundamentally, the assurance that people will not suffer financial hardship in using services is a recognition that health systems should not only improve health, but its improvement should not be done in ways that are detrimental to non-health aspects of well-being. Actually, currently, over 100 million of people are pushed into poverty annually across the world because of high out-of-pocket expenditures on health, according to WHO. Catastrophic health expenditure, defined as large out-of-pocket spending in relation to household consumption or income, has increased continuously between 2000 and 2015. Latest data show that the percentage of the population impoverished by out-of-pocket health spending increased from 1.8% in 2000 to 2.5% in 2015. This now leads us to discussing the two types of health coverage. First, free and universal health coverage. Second, universal and affordable health coverage. And there's a debate ongoing about which type of coverage is best suited to fulfill all three key objectives of equity, quality, and protection against financial risk. Let's talk about free and universal health coverage. Under this system, everyone receives full coverage regardless of their ability to pay. The government is the only entity paying for the coverage, most likely funded through taxes. One concern with this system is that government funding is limited. So often there are limits on what services are covered. Individuals need to pay for additional services. Let's talk about universal and affordable health coverage. With universal affordable coverage, all individuals receive access to healthcare services, including preventive, emergency, and palliative care, without it becoming a financial hardship. In this system, the cost of universal healthcare are covered through a special payroll or income tax, which would be combined into a pool to pay healthcare providers. Another option would be to require all individuals to purchase a health insurance policy with government assistance available to those with limited incomes under the copay model. Which is better? There are pros and cons for each type of coverage, and it's hard to say which is better. Because a universal and affordable health coverage system doesn't rely solely on government funding, it can provide better coverage for each individual. On the other hand, with a free and universal health coverage system, individual coverage is limited, and most people would have to pay to supplement the insurance. A free and universal health coverage system could lower healthcare costs because administrative expenses are much lower for a government-funded system than for a private insurer. Also, with no competing insurance companies, there's less money spent on marketing and advertising. Finally, the government is able to reimburse providers a lower cost for services than a private insurer. A problem with both coverage systems is whether or not the government will have to raise taxes in order to fund it. While actually most people want to have an affordable healthcare solution, very few people are willing to pay more taxes to get it done. The debate over universal and affordable health coverage versus free and universal health coverage isn't over. Hopefully, an effective solution will become available soon. What is WHO's assessment on universal health coverage? At least half of the world's population still does not have full coverage of essential health services. About 100 million people are still being pushed into extreme poverty because they have to pay for healthcare. Extreme poverty is defined as living on $1.9 or less a day. Over 930 million people, which is around 12% of the world's population, spend at least 10% of their household budgets to pay for healthcare. This is the pre-COVID-19 situation. The world has changed substantially in 2020. All United Nations member states have agreed to try to achieve universal health coverage by 2030 as part of the Sustainable Development Goals. I personally remember my time living in the Philippines a while ago. At that time, 40% of the population would never, ever in their lives visit a doctor. By 2030, more than 5 billion people will lack access to essential health services, according to one estimate from the United Nations. Those services include the ability to see a healthcare worker, access to essential medicine, and even running water in hospitals. Where in the world do we find universal health coverage? Universal health coverage is a broad concept that has been implemented in several ways across the world. There are countries with universal but not free healthcare, and there are others with free but not universal healthcare. The US is a healthcare outlier in the developed world. It is the only large, rich country without universal. Similarly, citizens of several African, Middle East, Asian, and Southeast Asian countries do not have recourse to any form of universal health coverage. Here is Biocon Biologics' point of view on universal health coverage. Healthcare systems across the world are serving the affluent, but they don't achieve in many places the access to healthcare for the many. Our company, Biocon Biologics, is challenging the status quo by not categorizing countries by income classifications, but by access to healthcare. The COVID-19 test shows there are countries with free and universal healthcare provisions, or very large proportions of GDP spent on health, but even in these countries, it does not truly translate to access to healthcare when needed. For example, Britain's National Health Service was created on the heels of World War II to tackle the vastly unequal health outcomes and life expectancies of British people across the socio-economic spectrum. But over subsequent decades, it became clear that the NHS has left health inequity basically untouched. The situation in most of the world countries is that they have statutory provisions for free or affordable universal health care, but access to it is widely variable. To quote actually the WHO Director General, strong and resilient health systems are the best defense, not only against outbreaks and pandemics, but also against the multiple health threats that people around the world face every day. Let's explore what universal health care is not. Universal health care does not mean free coverage for all possible health interventions, regardless of cost, as no country can provide all services free of charge on a sustainable basis. Universal health care is not just about health financing. It actually encompasses all components of the health system. For example, health service delivery systems, the health workforce, health facilities and communication networks, health technology, quality assurance mechanisms, as well as governance and legislation. Universal healthcare is not only about ensuring a minimum package of health services, but also about ensuring a progressive expansion of coverage of health services and financial protection as more resources become available. Universal healthcare is not only about individual treatment services, but also includes population-based services, such as public health campaigns, adding fluoride to water, controlling mosquito breeding grounds, and so on. Universal healthcare is comprised of much more than just health. Taking steps towards universal healthcare means steps towards equity, development priorities, and social inclusion and cohesion. What needs to be done by governments, institutions to provide universal healthcare? Universal healthcare requires political will and commitment to good governance for healthcare. It requires strengthening health system, starting with an effective primary care system. It requires robust financing structures. They are key and includes pooling funds from compulsory funding sources. availability, accessibility, and capacity of health workers, quality, people-centered integrated care, sound systems of procurement and supply of medicines and health technology, as well as well-functioning health information systems and good practice examples are needed. How would organizations, companies need to act to contribute to universal healthcare? As an example, let me share how Biocon Biologics seeks to contribute to universal healthcare. We are a global company focusing exclusively on developing biosimilars, which are safe, effective, and highly similar versions of approved and authorized biological medicines used, for example, to treat chronic diseases such as cancer and diabetes. We have set ourselves a mission to deliver world-class quality products to millions of patients globally who currently can't afford biologic therapy. For instance, TRASTUZUMAB for the treatment of a specific type of breast cancer was inaccessible to most patients in India because of its high price. In 2014, Biocon developed the world's first biosimilar version of trastuzumab and made it accessible to several thousand of patients in India. And today, our biosimilar trastuzumab is making a difference to breast cancer patients also in the US, in Europe, Canada, Australia, and in most of the world countries. Let's have a look at diabetes. It has been nearly 100 years since insulin was first used to treat a patient with diabetes. And actually, it's quite unfortunate that lack of equitable access to affordable insulin remains a key impediment to successful treatment for diabetes, leading to comorbidity, complications, and premature death in most parts of the world, even today. In the 2000s, India was home to a quarter of the world's then 120 million people with diabetes, and they only had access to expensive imported insulin. We started our own insulin development program and launched a high quality, safe, effective, and affordable recombinant human insulin in 2004. Our price was a fraction of the prevailing insulin prices and compelled innovator companies to drop their prices. We launched Mission 10 Cents to create universal access to high quality insulin by providing recombinant human insulin at less than 10 cents, US cents a day. Governments can procure directly from us in low and middle income countries. Our aim is to provide our insulin products to 1 in 5 diabetes patients in need of insulin-based therapy anywhere in the world. We want to be part of the efforts to transform healthcare to ensure universal health coverage. Our aim is to redefine how healthcare is delivered to patients, like Amazon has changed the way we are shopping today. We are catalyzing venue shifting by empowering patients with innovative healthcare solutions that move patients' care from hospitals to non-clinical settings, like their homes, thus reducing costs. We have a partnership to provide an innovative digital therapeutic solution that can be paired with insulins, which allows patients to improve outcome while at home and reduce costs to healthcare systems. What needs to be done to work towards universal health coverage? We need a fresh perspective and steely resolve if universal health coverage is to become a reality. No one can be left behind. Even one person with an unaddressed condition means the universal health coverage safety net is broken. Healthcare has a role for everyone, not just hospitals, healthcare workers, and companies and labs producing drugs and diagnostics and vaccines. New partners in distribution, energy, devices, foundations play a role too. For example, in rural areas, in some countries, lots of people are prone to snake bites. Studies have shown that 40% of snake bites occur between 5 and 10 p.m. and 60% of bites occur in and around the house. Thus, the improved lighting use with lamps placed at strategic locations can help bring down the number of snake bites and resultant deaths. Every stakeholder needs to see outcomes of health from their contributions and be united by joint purpose. The health policy that we plan and implement as nations have to be comprehensive. The issue of health and well-being needs to be tackled from various angles, including primary, secondary, and tertiary healthcare, while taking care of both prevention and health promotion. Patients and patient groups recognize that achieving universal health coverage is a necessary condition to build sustainable and prosperous societies. To achieve this, universal health coverage must be patient-centric, and patient organizations and groups are in a key position to suggest what patient-centric entails in this regard. Let me end by saying you will be the next generation of leaders and will have an important part in making universal healthcare a reality. The COVID-19 crisis has proven that healthcare is among the most pressing global challenges that humanity faces currently. Wish you all good health and stay safe.